When we're looking at X-rays, we really do need precision, and there are ways in which we can use IntelliViewer to maximise our feedback, positive feedback, which helps direct treatment programs. Now, in the case here, I've started to measure this gentleman's X-rays down low, and I thought I'd take you through that as well. And so what I'm doing is I'm going to look at ways in which we can fudge results, and we don't want to fudge results at all. And I'll give you the context here. This gentleman started with an 11-degree tilt in this area in here. It then dropped down to 7 degrees, and then 7 degrees again, and then 7.3 degrees again, before his fourth X-ray, which showed that his curve got worse. And it got worse, and it's now at 10.26. And I need to know why it got worse. So I suspect that there might have been some heel on the chair activity here, which was responsible for this, or a side-lying activity that we were doing that was responsible for this as well. But in terms of getting reductions in days, it makes precision even more, all the more important. And I'm going to just share with you some of the ways in which we can get caught out with this. So you'll see here that I've enlarged the image, but I'm just going to take it back and bring it into a position where we can see a little bit more globally why I've chosen this vertebra here. Now, you'll see probably with the eye that 5, 4, 3, 2, lumbar, 1, lumbar, 12, thoracic in this area in here, and there's the ribs just to confirm that. But you'll see here why I've chosen the second lumbar and the inferior end plate. And that's simply because we again enlarge that, it's the one that's got the most tilt. If I take this line and I bring it up to this vertebrae here, you'll see how if I bring that up just to the end plate there and bring this down, you'll see how that changes the angle. So what was a 10.26 is now an 8.66. I don't want that. I don't want to have that miscalculation in degrees. It's all too easy. So I'm just coming down there, and again I'll enlarge it so that we can see what I'm doing. But notice how you've actually got to go from the tip of that rounded section of the vertebra there to just there. All right, notice how it changes its direction at those 2 points. 10.26, again, that's fairly accurate in terms of what I want. And I want that feedback to know that am I doing the right thing or am I not doing the right thing? Now, incidentally, this 10-degree angle in here is only part of the equation. So if we bring down the other vertebra, the thoracic section of the spine, and I'll just change that around so that we have right on right, and there's the heart shadow there. So that's the, now we're looking at the person from behind. But if we start to measure this as well, let's get an enlarged section of this. I probably want to come to that vertebra there. That'll be the most tilted. This would be the vertebra that I'm going with in here. And we can measure that. Oh, and we'll enlarge firstly, just to get some magnification helping out. Bring that vertebra back into play. Now, I don't know what my horizontal is just yet, but that's why this line down the bottom becomes very important. So if you've used IntelliViewer before, you want to make sure that your horizontal is horizontal. And now we want to compare. Well, that vertebra is less angulated. That one is the one that we've measured. And both of these vertebrae will do. So let's leave it at that. And we've got a 7-degree curve, 7.1. So we had a 10.26 and a 7.1. That gives me a 17-degree curve. And we've got this curve measured here at an 11-degree curve. And it's far from 11. It's actually 17. So it's very tempting for a practitioner to, after a few weeks of care and charging for their services, to try and hide behind the fact that the radiologist has measured this curve at 11 0.4 degrees, and that's just unacceptable. He's even got a 10 degrees in there from T7 to T12 or T5 to L2. Neither of those measurements are accurate, and nor should we be presenting them as proof that the radiologist has stated that our treatment's effective. It's not effective. This curve actually went up, and that's the reason why precision is important. We don't want to deceive ourselves or our patients. We want to learn and grow from these mistakes that do occur. Scoliosis is not an easy thing to treat, but it can be treated in a conservative manner, non-surgical and non-bracing, and it can be done so in rapid time frames. We're talking days. So it's very important now that the feedback that we give ourselves is consistent and precise. And that was the reason for this video. Let's continue to advance scoliosis care through accuracy and honesty. Thanks for watching.